Thank you, Mike. Good afternoon. Yes, PATHeD is a new project starting 1st of January next year. It was initiated by the Commission. Stands for enabling patient access to their health data, and financed by a direct grant. Lasts 18 months, so it will be a rush. There will be 11 member states participating, of which 6 will deploy the system what we develop. And Mike, at the very beginning of the preparation, drew our attention to InteropEHRate. So immediately I looked for it and Googled it and read all the available information. And I'm grateful that I'm invited. Thank for that, because I've learned a lot. And the initial phase of this PATHeD project will be a landscape study. So we will be connected. I need you, because InteropEHRate results will be a large chunk of the landscape analysis. And congratulations for all these results, because we will use that, and we need all these results to implement. Yeah, okay. So this is the original EHDS My Health EU at EU infrastructure, as you called it, top-down approach. And here the health professionals have the right to access data, and the infrastructure, national infrastructures communicate with the support of the central terminology services. And in the new project, we will develop a toolbox of app components. And in this system, national contact points, so the member states will upload their translated terminologies, so local language terminologies, and allow the other countries download these terminologies. And the translation will be done in the host country without communicating between two infrastructures. So one single infrastructure with the support of the central terminology services will provide the necessary connection towards the patients, the individuals, and they will be able to access to their registered health data. First, in this project, we will use patient summary, but very soon after the start of this project, we'll start an EID wallet project, and we hope that it will be financed as well. So e-prescription will use the EID wallet identification system and the storage system. So what you have already envisioned will be used here, and I think the two work streams will meet through the EID wallet solution. And when we look at the future solutions, and are here, John, you, Francesco, what you have presented, this infrastructure and solution can be one background solution that supports what you have just described in your presentation. So in the near future, we will have central algorithm services, and the pervasive health, everyday health support will be in our mobile phone. We have just started or start this development and implementing different elements of it, but this is the clear future. So in 10 years, we will have a system like that, and we are working to achieve this system. Where we stand now, at the very beginning. This is an excerpt from the OECD recommendation. It was published 2019. And if you look at the value-based principles and implementation guide, trustworthy, human-centered, explainability, accountability, safety, and well-being. So many of the principles are related to humanity human values and emotions, not technical details. So when we are concentrating on AI and the personalized medicine, we always need to keep these principles in our eyes and make all the developments accordingly. What is really important now that we are in a great transition. We are between two ages. Such an epochal age change was 500 years ago when the Gutenberg galaxy began. So it's a huge, huge change. Everything is changing. New models are needed. And the data is the major resource. When we look at the values we are able to generate, the European landscape is, modestly speaking, colorful. So this is a health literacy study from 2019. And you can see that there are huge differences between understanding different health messages, health information. And in some countries, 1/3 of the population simply doesn't understand what we are speaking about. So we can generate very nice information. We can generate nice AI solutions. We need to make all the efforts to achieve a better understanding of our messages, and health literacy and citizen involvement is really important, much more important than before. What TEDx says about this situation? TEDx is a joint action which started to develop the European health data space and lay down the foundation, the basis of the European health data space. This is a report of the work package 8, which is called Citizens. This is a milestone report saying that citizens have a central role building trust because they need to share their information. Citizen and patient engagement is not just stakeholder engagement. So we need to collaborate with citizens. We need to find novel solutions to work together, to cooperate, co-create with patients. Mm-hmm. And we need further discussion on value created with the data. And we need different models, what you have mentioned, Francesco. So we need new type of studies. We need further discussions because we are not really sure about how to create value for our citizens. I'm not very good at that. We frequently discuss two pillars of the European health data space. This is privacy, security, and the other one is the fairness of data, accessibility, interoperability, reusable, quality informations. And there are always disputes between the representatives of the two major scopes. Seems conflicting. However, when we add a real European value to that, thank you. So when we consider usefulness in a specific situation, we can always coordinate the two seemingly conflicting pillars and scopes. And this reflects very much what TEDx said, that usefulness, utility is very important. And in the member states, again, Francesco, what you have said, we live in a healthcare environment. In Europe, all member states built their healthcare system and social care, social security system around public good. And we have very little discussion on that on the European level. So we need to start to discuss how to harmonize the different aspects of the member states, different systems of the public good creation, because without this scope, we are not able to utilize the data what we are generating and what we have in our systems. Do we have any opportunity for that? Do we have European values? Yes, we have. This is another research. Please help me, Mark. This is before last slide. So this is a study, again, it was published 2 years ago. Yes, we have a European value set. Self-transcendence is one of the most important elements of the European value set, which means we are all keen on a higher value. In other words, we are keen on public good. So we need to concentrate on public good, and Europe is ready to do that. What is the problem? All the system, industrialized system, managed by an American model built on self-enhancement, because in the US, self-enhancement is the biggest value. So we do not have a proper model for the utilization of the data, and we do not have a proper management model and value set for the utilization. So that's why we need to discuss this much further. We need to open the discussion to achieve a common public value and utilize the European value. And this will be the way how we are able to generate value from data and generate useful artificial intelligence solution. So this way we are able to shape the future, and our collaboration is needed for that shaping. Thank you for your attention.